Well, hello, everyone. I want to welcome you to Fertility Specialists of Houston's first webinar on how to manage stress during fertility treatment with our special guest presenter, Dr. Irina Milentijevic. She is the psychologist, here at FSH. Before we get started, hopefully you are all looking at the screen that says over 5,000 babies and counting. And we will get started very shortly. We are recording this session so that it will be available for playing also at a later date on our website. I believe you can ask questions on your toolbar, and we will be doing that later in the session. So at this point, I think we're going to get ready. Dr. Irina, are you ready for us to get started?
Yes, thank you, Chris.
Okay.
Okay, I have it. I have it. Hi, everyone.
Dr. Irina?
Hey, are you, let me just.
We're all set.
Okay, are you seeing?
We're all set.
Okay. Good evening, everyone. Welcome to our webinar, first webinar on how to manage stress during infertility treatment, sponsored by Fertility Specialists of Houston. My name is Dr. Irina Milentijevic. Okay, I guess you can see now. I'm a psychologist here. And I actually help couples and individuals who are trying to, have babies and have a family really feel empowered and understand what their choices are of having a family and, fulfilling their dream of being parents. Let's see, what is it that we'll be talking about tonight? First thing, we'll talk what makes infertility stressful. Then we'll try to understand how are stress and infertility related and linked. And certainly we'll talk about practical ways and things that you can do to manage stress. Okay. Infertility is stressful. Regardless, stress is absolutely real, regardless of how you got to this point. This is what you're going through is absolutely real. It's not in your head. It's not imagined. We talk about, stress level, and also with chronic stress, there's, anxiety and depression that is really comparable to having a, terminal illness or having, chronic physical illness or even death of a loved one. So what you're going through is very, very difficult and can be very stressful, at times. Let's look at, this a little more closely and try to understand why is infertility so stressful? What makes it, so stressful? First thing, it's inability to get pregnant on your own for, 6 months, 12 months, some of you even longer. And, wanting to be, have family and be parent is only natural. And it's, developmental milestone, and it's, a natural passage, that leads into adulthood. So, in addition to that, being really, frustrating and sad that it's not happening, there's cost of treatment that you're probably aware of, how expensive it is. Then, medical procedures, they're time consuming, especially if you're working, you have to take, time off from work. Medical procedures are very intrusive, very unpleasant. Then there's side effects of medication. And finally, there's, waiting period, of 2 weeks, and you never know, the outcome is unpredictable. So no matter how much you put in, you don't know what will, you don't have 100%, guaranteed outcome. And finally, something that used to be very spontaneous and pleasurable and fun, such as sex, now it becomes a chore. You have to do it, as prescribed by your nurse or a doctor. Is stress affecting your fertility? Yes. It's interesting. We don't really know the exact link, between stress and fertility, and we don't. So we don't really know the exact mechanisms. But we do know there are numerous studies that looked at that stress and fertility are related. And what we do know, it seems like that there are three major ways how stress can actually affect fertility. First thing, there's stress hormones may affect reproductive hormones. Secondly, stress can also cause unhealthy behaviors, such as smoking, drinking, overeating, and you also are probably aware how, obesity and high BMI can actually compromise fertility. And finally, there's emotional burnout, and marital conflict that can cause, couples to drop out of from treatment. So what happens with, if you have high stress level? Pregnancy rate can be actually influenced by high stress level, meaning psychological factors. And we do have actually also numerous studies that found that the higher the stress level is associated with lower pregnancy rates. Okay, let's, this is maybe a little more, technical, but let's look at, stress hormones and what happens with, stress hormones and its impact on fertility. You're probably all aware of cortisol, which is a stress hormone that's produced usually when we have fight and flight reaction, when we're stressed out. That can actually, production of cortisol can interfere with production of sex hormones, also known as gonadotropin-releasing hormone. This can be all pretty technical. What does this, practically mean? That can affect, cause low sperm count, irregular ovulation, meaning, number of eggs that are retrieved are diminished, and cause sexual dysfunction. Also, cortisol can increase gonadotropin inhibitory hormone. So, there's less, sex hormone released. We can also, let's look at actually now on how stress undermines IVF or in vitro fertilization. We do know that, studies have shown that women who experience higher level of stress may have up to 20% less eggs retrieved and fertilized. Also, even for those, women who are under, higher level of stress, may have lower implantation rate, meaning, lower pregnancy rate and also higher risk of early miscarriage. Probably because, stress can cause decreased blood flow that goes into uterus. Stress can also take a great toll on your relationship. And what happens is that women who experience and also report more stress, more marital stress during their IVF cycle may need more cycles to get pregnant. And finally, we talked about, emotional exhaustion. Emotional exhaustion, kind of like burnout, is the second leading cause for couples to drop out of, from their IVF treatment. Of course, finances are, crucial, but